Hello guys, how you guys doing? Hello everybody, how you guys doing? We are going to talk about if skilled nursing facility is the right fit for you. Is skilled nursing facility the right fit for you? Okay, so that's the question. That's the question of the day. And hopefully by the end of the video, you will be able to answer that. And so the first thing that I want you to think about if you want to go into a skilled nursing facility is that one, skilled nursing facility, we usually get patients who are being discharged from the hospital and they may not be fit to go back home because they need more rehab, so they come over to the skilled nursing facility to get more therapy. And then from there we can make a decision as to, can this person go home, or can this person go to an assisted living, or are they going to stay in a long-term care unit for long term. Okay, so that's where we make those decisions at that time. I also want you to remember that every skilled nursing facility may be a little bit different, but I know that I work a lot with physical disabilities, but also a little bit of mental disabilities as well. But I would say that 90% of my caseload was definitely, maybe not 90, maybe like 80% was physical disability, and then the other part was mental disabilities. So are you able to work with multiple diagnoses, okay, within the physical and mental disabilities? Can you work with people with stroke, with fractures? So hand fractures is what I'm talking about. Can you work with people with spinal cord injuries, with TBI, with MS, with lymphedema, with morbid obesity, with lymphedema, patients with schizophrenia, with dementia? Are you going to be able to work with patients with bipolar disorders? Okay, because I usually see patients who have multiple, meaning they have physical disabilities and they also have mental disabilities. So a patient who has MS but also have a bipolar disorder attached to that. So being able to treat both simultaneously will be something that you need to think about. Okay, and then you also have your patient who just have a physical disability and that's it, and then my patient who have just mental disabilities and then that's it. Okay, all right, the next thing that I want you to think about is, can you and are you able to work with other people? Okay, you're going to be working with other disciplines, other OTs, other coders, PT, PTAs, the therapy staff, okay, speech therapist, the manager. And then outside of the therapy department, you're going to be working along with a lot of nurses, doctors, social workers. You have GNAs or CNAs, nurses assistants. You have housekeepers. You have maintenance people. You have all of these people that you're going to be working with, that you need to learn how to work together as a unit. And that can sometimes bring its own challenges, and I'll probably talk about that in another video. I'm going to talk about the challenges with that and how to mitigate that. Okay. All right. Another thing that I want you to think about is, can you work with family members? Because this is something that I had to do often. I had to educate family members. I had to call family members and let them know about what was going on with their family member. Okay, what's going on with them? We usually have care plan meetings. It started being on the phone, but it can also be in person depending on where you are. And of course, COVID kind of changed that for a lot of people. But talking about, the patient's plan, like what is your plan? What is going on with them? How are they doing in therapy? Being able to have that communication with family members and being able to explain to them what is going on with their family member and how to help them if they need help understanding certain things, to really learn how to break things down, take away the jargons, and really break things down so they can understand from your perspective what you're saying. So communication skills, education skills, things like that. Teaching skills, I should say. Are you able to work under pressure? Because skilled nursing facilities are a fast-paced setting, so you need to be able to work under pressure if and when needed, because that goes along with productivity as well. Okay, can you maintain the expected productivity standard? Because most skilled nursing facilities do come with productivity standards. Are you able to do this? Okay, this productivity number, whatever the percentage is, depends on that company for sure. And I think that some companies try to be ridiculous with the number. Let's just be honest with that. I mean, 90, above 94 evaluating therapists is just not okay. And so really think about that when you are looking for a job. Think about what company you are working with. Ask them about their productivity standards and ask yourself if you'll be able to meet that. Make sure that you are someone who's going to be ethical. Make sure that you're someone who is confident in your skills, confident in your decision and making skills as a clinician, because you're going to have certain incidences where you have to do what's ethical. You have to do what makes sense in your clinical judgment. So going back to your ethics, thinking about ethics and what that means, being able to make sound judgments, sound clinical judgments is going to be very, very important in this setting. Clinical judgment is so important because sometimes you might be pressured to make certain decisions that may not necessarily be appropriate, may not be ethical. And so you need to be confident in saying no and tell them why. No, I cannot do this because it is not ethical. I don't feel confident doing this. I don't feel comfortable doing this. And I am not going to do it because I just don't feel confident in doing this. And that is your right as a clinician. You are registered and licensed, and you have been entrusted to do the right thing. So make sure that you're able to make those sound clinical decisions, clinical judgments. Are you able to manage your time effectively? Time management skills is so important, but I think that I always say that I learned how to manage time definitely in OT school, and it carried me through my career as an OT, okay, and it's still with me when it comes to time management with my business that I'm building. And so, yes, time management is always important. Being able to manage your time goes with being productive and being able to not get burned out. You have to learn how to manage your time, not take work home and things like that, okay? Learning how to communicate, and also not only to communicate but also to listen effectively, is going to help you a lot. Okay, you need to learn how to communicate with other staff members, and you need to learn how to communicate with your patient, and also to listen to both people. So listen to your coworkers and listening to your patient, but also standing firm in your belief as what you think is right when it needs to be said. Right is right and wrong is wrong. Okay, so being able to also be confident in that as well. You need to learn how to justify your treatments as a clinician, as an OT. Okay, and I say this because this needs to be shown in your documentation skills. We need to show the reason why insurance should pay for our services as OTs. Why should insurance pay us for the work that we do? So we need to make that clear in our documentation. Document well, document effectively. Let it be shown what you are doing. What are you facilitating? What are you grading? How are you doing activity analysis? How are you helping this patient to be able to achieve their goals as an OT? Why should we pay you? So always think about these things and always make sure that that is being reflected in your documentation. So that's also a skill that sometimes I feel like it does come with experience. Okay, moving right along. I know this is a lot of information, guys, but I really want to give you guys all the meat, okay? Because this is serious stuff, and I want you guys to make the best decision for yourself. All right, you need to be able to advocate for your patient when needed. This is so big, especially when it comes to people of color, patients of color. This is very, 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 very crucial. Okay, and I am speaking from experience, being a person of color myself, and also having patients who are people of color. Sometimes we need to advocate, okay? So you don't need to be black to advocate for black people, obviously. You can be any color and advocate for people of every color. So I advocate for everybody, all my patients. It doesn't matter what color you are. If it's wrong, it's wrong. If it's right, it's right. And that's what I go by. And that's just how I do my things. And I think that if you're a clinician and you don't know how to advocate, if your higher boss or if whoever is doing something that is not clinically appropriate, or it's not ethical, or you just feel like it's not right, you need to learn how to speak up on behalf of your patient. And not because I think that a lot of people are scared to speak up because they're scared to lose your jobs. But are you not doing a disservice to your patient by not doing what, by not giving them the help that they need, by not giving them the resources that they need, that the treatment that they deserve? I think that's your job as a clinician, to make sure that you do that. And I think that failure to do so is failing our patients. That's just all I'm going to say about that. All right, we'll leave it at that. The last but not the least on this list is you need to put patient care, quality patient care. Quality patient care needs to be at the forefront. It needs to be before anything else. In my book, that's what I do. I need to make sure that whatever decision that I'm making, whatever that I'm doing, that I am providing quality patient care for my patients. I need to make sure that the care that I'm providing is quality care. And what I mean by quality care could be something very small to something very, very big. Okay, this can be very subjective, but making sure that you're doing what it needs to be done to put your patient first, and make sure the patient is getting the help that they need, the care that they need, the treatments that they need. Okay, that is what I mean by quality care. Putting your patient quality care first before anything else, before productivity, before all of that stuff. Because at the end of the day, if you are very productive, if you are 100% productive, but you did not give your patient the quality care that they needed, the quality treatments that they needed to get better, to improve, to go on and live their lives, you haven't done nothing. Okay? You get a check mark by your boss because you're 100% productive, but your patients are over there not getting the service that they need, and you're proud about that. I think there's something missing here that we all need to fix. If this is a global issue, then it needs to be a global conversation. It needs to be a global solution to it. So I honestly feel that that needs to be something that we talk about a lot more. What is quality care? What does that encompass? And are we doing that? Or are we just worried about getting a check mark for productivity? So that's a whole nother topic for another day. But yes, that is it. So if you feel like you fit all of these, but don't be scared. So I'm gonna put a disclaimer and say, like, don't be discouraged if you feel like, oh, I don't have that, therefore I'm not, SNF is not for me. No, I didn't have everything on this list, but I definitely gained it through experience, and also through motivation and being inspired and having passion for the setting. So, and passion for the work that I do. So if you have, that's why I always talk from a place of passion and purpose, because I honestly believe that if you have passion and purpose, that the passion and purpose is going to drive you for you to do what it takes to be good at what you do. Okay, so that is all I'm going to say about that. Don't just say, hey, I don't have this, I don't have that, so I cannot be a skilled nursing facility OT. That is not true whatsoever. If you ever feel like you need one-on-one consultation with me, I do provide that service. I'll leave all the information about that below, and I'll also always leave my email. If you want to email me, DM me, we can definitely chat about that. You can schedule an appointment with me, and I can give you that one-on-one attention that you need. Okay, so yeah, that is it. I think it's safe to call myself the SNF queen by now. But I will say that even though I've been working for 4 years, I don't know everything. I am still a learner. I still learn new things every day. I'm still open to learning even more things. So yes, always be open to be a learner, be open to learn new things, be open to enrich what you already know. And yeah, that is it. Thank you guys so much for watching this channel. I hope that this was useful to you. If it was, go ahead and hit a thumbs up, like, comment, subscribe, and I will see you guys in the next video. Bye guys.